In this episode of the Nurse Practitioner Podcast, Dr. Susan J. Corbridge and Dr. Sheila Melander discuss burnout. How large of a problem is burnout?
Burnout is becoming increasingly a major problem in healthcare, and it's really looked at now as a public health crisis for the nation. And we have little data in nurse practitioners in particular, but we do have data in physicians and nurses and critical care in particular, and have trouble with burnout. And individuals in critical care and also in emergency medicine really are at high risk for burnout. And as many as 78% of physicians have been symptoms of burnout, as well as up to 42% of critical care nurses. And in data in critical care nurses in particularly, up to 86% of them can have at least one of the symptoms of burnout.
So in our advanced practice providers, we're just now starting to look at that. And there was actually an article December 2018, and it was a Journal of General Internal Medicine. And they actually did look at burnout among physicians, advanced practice clinicians, as well in primary care practices. But as Susan alluded to earlier, we're still trying to pull that data together for our hospital settings. But you can imagine they were able to show significant increases even in the outpatient setting. Acuity is grown and the complexity has just quadrupled over the past 6 to 8 years. And so we are trying to integrate into the educational processes ways to build resilience and ways to help our nurse practitioners as they are graduating. And we need to be employing those into the clinical setting as well. There are some facilities that are doing great jobs, but then we need to pull the rest of them up to help with resilience with our advanced practice providers deal with these burnout issues.
How does provider burnout impact patient care?
Well, we know that when providers are burned out, it is associated with lower quality of care and lower patient satisfaction, as well as increased number of medical errors, which, of course, is a major issue for health care and for patient quality of care in the country. We also know that burnout is associated with increased risk of health care-associated infections and also higher length of stay and mortality. Also, individually in providers, burnout is associated with alcohol abuse or substance abuse in general.
I was just going to say, just building on what Dr. Corbridge said, on the more personal side, we can't ignore those. Those are the paramount things that Susan just described. But on that more personal side, we see emotional exhaustion. We see providers begin to depersonalize. We also see when they're questioned, they have a lower sense of accomplishment. So then when that is gone unchecked, then you can see how then we start losing providers to those areas, and the gaps that we have now even become greater gaps.
I was just going to say the other thing, not only the individual provider, but it definitely wreaks havoc on family members as well, because the individual provider when they become burned out, it also can, you take that home to your family. And, you have somebody who's burned out, and it's very hard.
You can't turn it off. You think when you leave your work there, but we don't. You get home and you can't turn that off. And did I do everything that I could have done that's in my toolboxes for that patient, for that family, for that team? How can I think out of the box with this particular scenario, with this particular diagnosis, with this particular trajectory of this disease? What else can I tap into? Because we're taught never to give up on that patient. So you don't.
How does burnout specifically impact nurse practitioners?
Well, burnout, as we just talked about, definitely impacts the individual provider and can impact all aspects of your life. And in nurses in general, as well as physicians and other healthcare providers, we know that the numbers are continuing to increase. With that comes whole stress of everyday care, and again, especially in critical care, because those in acute and critical care are more likely to experience burnout. Even burnout in other providers, as other providers continue to turn over, that puts more of a toll on nurse practitioners in general. So, that continues to be a big issue that can extremely impact nurse practitioners and nurse practitioner practice. And Sheila, what are your thoughts about that?
I totally agree. And we are utilizing nurse practitioners very differently in different areas across the country. So there are certain areas where nurse practitioners are utilized to the full scope of their practice. There are other pockets, and in January in the Nurse Practitioner Journal, they publish every January the states that have full scope of practice, the states that are limited with their scope of practice with the medical boards as well as the nursing boards. And then they list the states where you have to have collaborative agreements and there's a lot more stringent guidelines. So as you progress across the state, the activities are very different depending on where you're at and what your responsibilities are. So if you happen to find yourself in one of those areas where you are one of the first NPs in that role to be able to really stretch and reach and meet the needs of those patients. And if you're alone in that area, if you don't have an interprofessional practice that provides you that network and that other person to reach out or other people to reach out, then that possibility of burnout is even raised more dramatically for that population. So I think it's great everywhere, but I think it's greater for our providers that are in those areas that find themselves without networks.
Why is burnout increasing?
Well, the healthcare systems have become so increasingly complex, and we know in particular that the electronic medical record has definitely contributed to burnout, and it continues to contribute to burnout on a regular basis. And also other things like patient numbers and the high acuity of patients, as well as malpractice concerns, dealing with payers, student loan debt, and then, of course, work-life imbalance. So all of these things contribute to burnout and the increasing numbers with it. And it continues to be really an issue for all of our providers. So that's hence why it's really becoming a call as a public health crisis for the nation.
I agree with that, Susan. I don't think I really have much to add on that. The complexity and the patient acuity levels, and it has really dramatically changed. Susan and I both practice, and just within the time that I've been practicing as an acute care nurse practitioner, the time that I spend on the phone with insurance companies trying to get a stress test approved or trying to get a treatment modality or a medication improved takes up about 20% of my day now. So, and that was not the way that it was when I started practicing almost 15 years ago. So it has changed. Susan, are you finding that true in your practice?
I do agree with that. And I think that the hardest thing for me in my clinical practice, it has been the electronic medical record and the time that it takes to do the documentation that you are required to do. And it really takes time away from that direct contact with patients. And that, especially for nurses, is incredibly stressful for nurses and nurse practitioners because we are very patient-centered, patient-focused. But because we have gotten so busy, really in order to, survive your day, you end up, when you're with a patient, you spend, unfortunately, a lot of time that you have to be in the medical record, and that's really hard and stressful. And at the end of the day, what happens is you end up having to go home and then do more charting and more work. And so it's work after work. And that's really a change in the last 20 years that I've been an NP that I've seen. It's been the biggest change. And again, really the hardest thing for me as a practicing nurse practitioner, and I know my colleague, we discuss it on a regular basis. And the literature supports that as well. And Sheila, do you find that with charting?
Oh, it's crazy. Right now we are, and where I was before, we used one modality in one of the hospitals I was at, and we had a second EMR, a different type at another. So that happens too for those of us that have to go to more than one system to see patients. So, Susan, I was just going to validate where you had said the literature. Actually, in the upcoming burnout article, in the academic medicine, one of the studies cited that the residents were spending less than 10% of a typical day shift interacting with patients and over 50% with the computers. So it's dramatic, as Dr. Corbridge was saying, but that's a huge time shift. And Susan actually is the one that found that article that cited that, so it just really makes the point, drives it home.
What can be done to decrease burnout?
Well, a lot of it, there are individual factors as well as organizational factors. And really, if you look at the number one causes for burnout, most of them are from the organizational level, meaning, the high workloads, the EMR, and the EMR criteria responsible for billing, that you have to, the documentation is so intense. And so some of those, of course, are at the organization level. So there are many things that can be done at that level to really focus on decreasing burnout. And one of those things that we really, again, more focus is being put on in the literature, as well as I believe this, because I also in my own personal practice experienced this, that when you have interprofessional teams and really can take a team-based approach to workflow, and it really does help decrease burnout. And it really is something that I think is so important, that instead of practicing individually and being in individual silos, that really taking a team-based approach and an interprofessional approach to practice is definitely needed. The other thing, too, though, also on the individual side, it is important that we all learn to take care of ourselves. And sometimes people that go into healthcare, obviously we put the patient first, and the patient needs to be first, but sometimes you end up spending so much time, trying to put everybody else first, that your own needs go last. And that, of course, doesn't do well, because if you're not healthy, you can't take care of other people and you can't help other people. So I think really focusing and making sure that, you take your vacation time, and that you can say at the end of the day, I'm done. I'm going to do the best I can, but I'm not going to go home and then work for 5 more hours. Really to take a break, and to be supportive of your colleagues to do the same. I think that's been a big change, too, that we've all seen that's been helpful, that, our colleagues are now, we're all very focused on individual wellness and the wellness of our colleagues as well, because, again, we know we can't help others and we can't do the best we can for patients unless we're healthy and well first. So, Sheila, what are your thoughts on that?
I agree with everything you said. And just to echo that again, Susan and I were able to speak on this topic in Reno, Nevada, at an acute care specialty conference. And we left the end of the talk open to see if there were any of our colleagues that were utilizing interprofessional teams for interprofessional practices. And we asked, had it helped, that effect on overload, burnout symptoms, and we were quite surprised. I believe, Susan, there were about 8 to 10 that raised their hand, that came to the mic, that were utilizing this strategy and had found it quite helpful.
Absolutely. I think sharing that approach to patient care is also really important. Patient care can be very stressful, which is one of the things that contributes to burnout. And so I know in my individual practice, when I'm able to, when many of us in our interprofessional team know the patient, we're able to really bounce things back and forth off each other, and we're able to really to make, I think, better decisions, because we're working together and collaboratively, and that takes a little bit of pressure off you as an individual solely making all the decisions alone. When you are, you've got a team and you can really put your heads together and take that interprofessional approach, and everybody utilizing their skill set and practicing to the top of their license and bringing their own individual skill set in. And it's important to have views of others in your team as well. And again, I think that it optimizes patient care and also really help decrease burnout too. And the National Academy of Medicine, is really taking an initiative to focus on burnout. And one of the things that there was a white paper that came out recently that really looked at team-based approaches to improve patient care, but also as a way to mitigate burnout.
Would you expand on why the Doctor of Nursing practice degree is especially important in helping prepare nurse practitioners to mitigate burnout?
We believe, and there's a new white paper from the National Organization of Nurse Practitioner Faculties, and I am a former president of that organization, and we are asking for the D&P to be what providers need to enter practice or to begin their practice, and we're hoping that we can have that by 2025. We've said this before, but this approach at this time, we feel it's so necessary because of all the issues that we've talked about today on the podcast, with the complexity, the acuity. This skill set that the D&P offers our advanced practice providers is necessary for them to be able to navigate the system and be able to have the successful patient outcomes as well as system outcomes. And that's what the DNP is all about. So it is a terminal degree. It came about because the American Association of Colleges of Nursing back in 1991, it was taking 15 to 17 years for bench research to hit the patient floor. So you know how that is. We can't wait. When we've got a patient issue, we've got to get on it. We've got to attack it. And now with our everything being tied to our RVUs and your outcome, time is money. So we've got to have those issues addressed. And what the DNP does, it's all about identifying patient gaps and gaps in systems. And so what the DNP is meant to do is connect those DNP students, those doctoral students, with a system to identify patient gaps or system gaps within their area of expertise, that the track that they're in for their doctorate, and then to learn those skills that they'll need when they're out to continue to meet those gaps. And, what our gaps are now are not what our gaps are going to be in 3 months or 6 months. It's always changing, and it's the most dynamic profession that I think you could talk about. What I do now is nothing like what I did when I started the profession, and I'm sure in 5 years will be nothing compared to what I'm doing right now. So to prepare our advanced practice providers to be able to be agile and have that flexibility, I think is just crucial.
I definitely want to echo everything that you're saying, but also I want to add, as we've been talking about, interprofessional teams and really moving towards a team-based approach, we do know that teams can definitely have positive patient outcomes as well as being a way to mitigate burnout. And so the DNP degree really prepares nurse practitioners to be leaders of interprofessional teams and really to know how to lead interprofessional teams. And so I think it's definitely an area that nurse practitioners can, and not just nurse practitioners, but nurses with the DNP degree in general can really take the lead and to lead these interprofessional teams and be a way to really improve healthcare.
Right. We have wonderful DNP leadership tracks that are really stepping in and making significant differences in our healthcare systems. So
absolutely.
I think that we're seeing very positive outcomes with our graduates.
This podcast does not constitute medical advice and should not be taken as such, and does not replace professional judgment or advice. The ideas and viewpoints expressed in this podcast do not reflect the official position of the speakers, authors, affiliated organizations, the Nurse Practitioner Journal, or Wolters Kluwer.